campaign, make sure that you go on to the Condom Castle after this and join in this wonderful initiative. We're also here in partnership and solidarity with the Victorian AIDS Council. The Victorian AIDS Council is focused on reducing HIV transmissions in Victoria by promoting the health of gay men and of people living with HIV. They're committed to working in these types of partnerships to improve health outcomes for the sexually and gender diverse community, and they have an army of volunteers down here today handing out red ribbons. That is the international symbol of HIV awareness, so please make sure that you wear a red ribbon today and again tomorrow on International World AIDS Day. We are also incredibly fortunate to be joined here today by Mr. Michel Sidibe, Executive Director of the Joint United Nations Programme on HIV and AIDS. Known to many of us as UNAIDS, Mr. Sidibe is also the Under-Secretary General of the United Nations. Since his appointment as Executive Director of UNAIDS and Under-Secretary General of the United Nations by Secretary General Ban Ki-moon, Michel Sidibe's vision of zero new HIV infections, zero discrimination and zero AIDS-related deaths has echoed around the world. Under your leadership, Michel, UNAIDS has worked to ensure that no one is left behind in the response to HIV and that everybody in need has access to life-saving HIV services. Michel has also initiated the global call to eliminate HIV infections amongst children, and his global advocacy has firmly secured HIV at the top of political agendas. Thank you so much, Michel, for sharing today with us. Before we hear a few words from Michel, I would like to just make mention of a couple of other very special people that have joined us here today. We are also joined today by James Chow, UNAIDS Goodwill Ambassador and CCTV news anchor all the way from China. Thank you. In his business and his news and business programs are watched in more than 80 countries on China's Central Television English channel CCTV9. On and off screen, James partners with the United Nations in fighting stigma and discrimination against people living with HIV. And he's travelled through India, Thailand and China, visiting anonymous testing centres, counselling services and local communities to listen, learn and help bring new awareness. Thank you so much for sharing today with us, James. And there's another man that I really do want to acknowledge in all the work that he's actually done to help bring these wonderful people here with us today, and that is a man who in his own right has done so much in his lifetime for the HIV response both here in Australia and around the world, and that is Mr. Bill Botel, the Executive Director of the Pacific Friends of the Global Fund. Pacific Friends is a high-level advocacy organisation which seeks to mobilise regional awareness of the serious threat posed by HIV and AIDS, tuberculosis and malaria to societies and economies in the Pacific. In pursuing its goals, Pacific Friends has specific interest in highlighting the need to protect the rights of women and children in the Pacific. Bill is a strategic policy advisor with particular interests in national and international health policy structure and reform. As senior advisor to the Australian Health Minister, Bill Botel played a significant role here in Australia in the introduction of the Medicare health insurance scheme. He was, maybe I should change this and say he is, Bill is known to so many of us as the architect of Australia's successful and well-regarded response to HIV and AIDS, and so many of us are so fortunate that he has shared so much of that insight with us over the years. So thank you, Bill. I also want to acknowledge Senator Louise Pratt. Thank you. And Louise Galloway from the Victorian Department of Health. Where are you, Louise? Hiding up the back there. Without the wonderful support of individuals like you, we just wouldn't be able to make these sorts of things possible. So thank you very much. One last round of applause. Thank you, everybody.